If you are sick, have tried to get help and is not feeling any better, then call or visit the Health and Wellness Center. Screen your entire body and the problem and treat you so that your body will overcome your illness. So visit us today, 72 Queen Street, Kitty, or call us at 231-6477 for further information.
Welcome to our program. This is a Thanksgiving program. And many of you are having your dinners and your friends and families are over and you're having a wonderful day. So Thanksgiving to all of you folks who celebrate Thanksgiving. This is one of the largest holidays in America, if not the largest holiday in America, where families get together and all the businesses pretty much closed down and you can't get nothing anywhere but turkey and cranberry sauce and vegetables and ham hocks and collard greens and all of the things that go along. You know, imagine you only grow them for them on Thanksgiving Day, or to kill them for Thanksgiving Day, and those poor gobbles, you don't only know. But the sad thing is, you roasting the turkey, and then you cooking ham. You're cooking the ham, collard greens, and the cornbread, collard greens, cornbread, cranberry sauce, cobbler. I mean, it's a big feast day today for Americans all across America and many other parts of the world. Thanksgiving. So welcome to our program today. Today we're going to have a program that will be long. However, we are going to be on for half an hour, and then we have a very interesting hour of a video that I think would interest many of you in many ways. So today we want to delve into some of the concerns we have. We know that many persons are living with diabetes, and they don't know, they're not really educated as they should be on what to do to help to control the diabetic state or to avoid from becoming a victim of diabetes. You know, persons who are eating the food they eat to be, and they need to change what they're doing with their diets. Just reduce the sugar intake, and not only too late at night. It's going to be a reason, but it's more today with me and Dr. Richard, who we had planned to do this some time ago. We'll try to get as much of it done today for you, so you could be prepared for the Christmas season that's coming. And many of you are not really aware of the Christmas season. We're in Guyana and in many other parts of the world. The Christmas holiday season is the largest holiday there is, because there's so many people. And even though there are all kinds of views about Christmas, we grew up hearing about that, and the children today, some are not aware of it. and Christmas will be coming past, but there's meaning there, and just stay focusing on the meaning of Christmas. It's coming. I don't care how you look. It's going to get here soon enough. Let's just over a month away. It'll be Christmas Day. And as a matter of fact, 1 month, 3 days, it'll be Christmas Day, right? We plan for the Christmas holiday season. We give out recipe for types of Christmas foods, the garlic and chunks, the black cake, and the pepper pot. We give 3 formulas out every Christmas season for persons who want to make those foods. Enjoy Christmas too, because a lot of people are not eating any flesh, using any eggs. So we give out the formula to make the cake without eggs, to make the pepper pot without animal, and the garlic chunks without potatoes. So stay tuned. Give it out 2 weeks before Christmas. So you will get it, not today, but it comes, so that you can have that formula, those formulas for your Christmas holiday season. All right, Dr. Richard, welcome to the program.
Thank you for the. I'm here. We're coming there. I'm Dr.
Yeah, Dr. Richard is visiting us with that, and he's here live with me in the studio, in our studio, so that you never saw us together. Today. We're not on separate screen.
Yeah.
Because he's here visiting, him and his wife are here visiting with us today. So,
Yeah.
Dr. Richard, welcome.
Thank you.
And maybe you can just highlight some of the things that you feel that you need to mention regarding the diabetes, and we can get into it. We have half an hour. We're gonna, to be get in. So, welcome again.
It's all about a day where people are, well, not again, but thinking about food.
Yeah.
Even here right now, I mean, I'm smelling food. But it's turkey, right? It's not turkey, and it's not the duck back there. We're not eating the ducks anyway, but it's food. It's good for us. But, to continue with diabetes, it's really simple. I mean, a lot of things we make so difficult, and they're really not. A researcher by the name of H.G. Hemsworth, over 90 years ago, looked into all the research that was done on diabetes. And they've done some extensive research on diabetes. And what he found is amazing. What he found, he could, and when he did that, with really has to do with diet. And then that point of view, we started looking at the research information. They looked at the diet of the people who were experiencing diabetes. And what he found was that the majority of deaths, at the time, based on of carbohydrates, consumption of fat, and we have carbohydrates, which comes from the sugar, right? Basically sugar. But that part, what he found out was those who ate carbohydrates and those who ate fat or animal protein were highly susceptible to acquiring diabetes, especially if they were using the Western diet, which is heavy with protein and animal. And then what they did, and you looked at the study that had people to reduce the consumption consumption of animal protein and animal fat, and he looked at the death rate. Initially, the death rate was 20.4 per 100,000 individuals were dying from diabetes. And when they reduced the animal protein and animal fat, they left the carbohydrate level still at the level, do anything to it. People were eating sweets and so forth. But when they reduced the animal protein and the animal fat, it went from 20 per 100. Significant. So what the understanding was is that we think that because people are consuming a lot of sugar, that's the reason for diabetes. He found earlier that that's not so. Right? It's a consumption of animal fat and animal protein with the carbohydrate that results. Then you say, I'm a vegetarian. As a matter of fact, I'm a lactarian, meaning I consume eggs and I consume cheese, but and still, even though I'm a vegetarian, I'm still coming on with diabetes. The thing is, eggs, cheese, dairy, they're animal products. And people who in those along with carbohydrates still milk, all that, all milk, dairy. So just to make it very simple, what he realized and what people are realizing even today is that the of it's animal consumptions.
But that doesn't give them the
clout. All the sugar,
sugar,
That's because your body's not utilizing because of the that's happening within the pancreas and other systems of the body. You're not handling well. It's the same thing like like any other thing. If you can't handle something, you shouldn't be utilizing it a lot. If you are drinking, I don't subscribe to all that. But people who have a very low tolerance to alcohol should not go and consume a whole lot of it.
Right.
It can kill you. So just a bit. So we have to be careful with our diet. And then the other thing people who are overweight, if you're overweight.
You're touching on a very sore subject there, Doctor. Very sore. Because in Guyana,
there are no overweight people in Guyana.
No, of course not.
Oh, okay.
We don't. Of course not. We don't have overweight persons, and we have obese people.
Oh.
We have people who are more than overweight. And there's a thing in Guyana. I don't know if it still exists. That people say, when you're not fat, you got AIDS.
Yeah, you're sick.
You're sick, when you're not fat.
That's
so
true.
Everyone was thinking that, well, I don't want to look fat, because they can think I get AIDS. They can think that they have a thing that goes with a big truck.
Oh, that's what that means?
That's what it means, yeah. When you look small, say, what happened to you, man? Truck or something.
Oh, wow.
Yeah. So many persons, the opinion, it is important to be fat. Yes. Opposite to what, as you just said, fat, obesity, overweight, it really contributes to diabetic or the diabetes state.
Oh yeah.
And it also linked to a heart condition. Every
other condition like that, tension, congestive heart failure, heart vascular disease, all the systems, even cancer.
We're not discussing that today because that is we take a lot of days to really talk about, which we talk about pretty much from time to time.
Yeah.
But cancer, obesity.
Yeah.
I mean, people they don't think about that.
Yeah.
So when you're obese, your hypertension and cancer,
Oh,
you know, so
you know. Yeah, you know, obesity, excessive fatty tissue. They have a lot of production of gym. You know, sometimes you see people, some men that are obese, they're effeminate, you know, because estrogen levels.
yeah, you want to know what size bra they wear.
But that, all the things.
Everything changes.
Yeah.
Their sex life is pretty much destroyed or
Everything,
reduced.
you know, the
Testosterone levels. They have more female.
Right.
You know.
Right. And you know that estrogen production leads to cancer and things like that. But we're not talking about that. But you know, diabetes. That's a lot of things. I mean, we can just talk about diabetes for the rest of the year.
Oh yeah.
You know.
Oh yeah.
But it all goes back to, you know, a lot of times this is what I'm seeing as I screen people. People are coming to us saying that the doctor is saying that I go on dialysis. You know, all electrolytes are off. You know, have patients like say electrolytes are off, and they're telling me about having dialysis. Really? Did they tell you that, you know, when they're going to start? Oh, no, they didn't. But what they did was show me a film, sort of get me prepared for the process. They're going to put a cord in, but they want to do an observational, they want to see exactly whether or not the kidney function can come. And then and screen them, they were pre-diabetes, you know. And, once you're pre-diabetic and it starts affecting your kidney function. You know, you go to the doctor, they can really see kidney functions, you know, are off. You know, all of the numbers are showing off, but the reality, what behind all of that, they're not able to see the pre-diabetes that's happening.
Yeah.
You know.
And the other thing is that persons need to use their common sense. I mean, the doctors are in a position to tell you pretty much, or to state to you what is possible to happen to you if you don't do things. And here is nutrition. Most of the doctors spend extremely little time on discussing nutrition with persons, so they're not really aware as to where to get off things that they eat or drink. And if you use something that is not being processed to allow your blood sugar to go back down when it spikes, and you have the symptoms, you frequently urinating, you are itching the body, you know, you feel like things are crawling in your skin, you know, you feel all you get, don't know what it is.
Yeah. And
then somebody said to you, you know, when you urinate in the toilet, you see them ants go high. Medicine to that. See those things. You need to take note and begin the process of reducing your sweets, your carbs, and your fats immediately. And if the doctor tells you that you need dialysis, seek a second opinion. And third, if necessary, to make sure that, because many times you were told that your kidney is failed, your kidney ain't got no life, your kidney ain't working. If your kidney isn't working, you will be dead. Seriously, you'll be dead, because that kidney's in there. What should be said is that the kidney is not functioning efficiently. It's not functioning as it's supposed to. It's not doing all of its work because something is impeding its ability to function normally.
Yeah.
And what they should do is to examine the reason, and that is what we do. We look at the reasons, we screen from head to toe, we link conditions that are the elevated, and we would say to you, listen, according to what is happening with you, this is what your body is saying you need to avoid. Not us. We're not the ones that are making that decision for your dietary changes. It's what is happening to your body that your body is saying to refrain from using these things temporarily so that we can get your kidney jump started again. Those who were told that you gotta get dialysis after your kidney gone to get a new kidney transplant. You gotta look for a donor. So all these things are things that scares you because thinking, oh gosh, my kidney gone, my kidney ain't working, But that you need to know that you really, if your kidney is not working or not, check the swelling in your body. Are you swelling up? Are your legs swollen? Are you retaining? Your kidneys isn't functioning properly. Your lymphatic system is failing. You're going to retain fluids. If you're not retaining those fluids, second guess what is happening to you, what you told. Is my kidney really working or not? If it wasn't, then I'd be retaining fluids.
Right. And it may be working, but it's not, like you said earlier, it's not
efficient.
There's some things may hinder the efficiency of the kidney that may not be very, you come early, you're able to, prevent certain things from going down, down that pathway, So it's just, if you notice it's going bad with any system in your body, nervous system, respiratory system, you notice, you know yourself better than you 24 hours yourself. So you can sense what's not right, is not wrong. Don't wait until the thing breaks down, come early, a lot of us spend, we in taking care of our cars that we do in our bodies.
Yeah, or bicycles, or motorcycles. We take care of those things.
Yeah.
We take care of our house.
Yeah.
I would always say to persons, I would ask them, how do you clean your house? So I clean my house every day. Really? Wow. Okay, good. Well, how often do you clean your house? I mean, when you mop everything out, cobweb, or do that about once a month?
Wow.
Well, listen. If you can do that for your house once a month or every day, what are you doing for your body? That's your house. Right. The house that you clean up once a month is the house you live in, right? You physically do that house. Now, the body that you have is where your spirit dwells.
Yeah. House.
So this is your home that you need to maintain. You need to cleanse once a month or twice. I say cleanse twice a month. Detoxify your system, deworm your system, look at your body system, listen to it. Every home should have a blood sugar testing kit and a blood pressure testing kit. Every home. When you feel something happening, you can check self-check your blood pressure. That way you know, look, I better stop eating all these fatty things now because the system getting bad.
Yeah.
I need to detoxify, cleanse, remove all of this stuff out of my system. That's what we teach. We teach you to take care of your body system so that you will know what to do.
And I see people sometimes, it's most amazing. You get pancreas itself, which is the one that produces insulin and glucagon and so forth. I find worms.
Oh,
do you see that?
We haven't touched that yet.
People don't deworm?
They don't deworm. So I would suggest detox, deworm.
Yeah.
Detoxify and deworm your system. Some of those tumors that are seen, those growths, cysts, they contain worms, and some of them are a nest of worms. You have to understand. We have to talk one day, Dr. Richard, about the worms and how they might chaos that they create in people.
Yeah.
The things that are seen on X-rays and ultrasounds that looks like tumors and cysts and all of that are a nest of worms that are there creating havoc in your body system.
Yeah. It's interesting, but but you were mentioning How often do you clean up your house? But some people never clean their house, you know.
Some people
Like
do
that.
it once a year.
You never clean it at all.
Christmas time they do. Some
No, but that type of cleaning you're talking about, they don't go up and dust and
I know what you're saying.
they don't do that detail.
Some person,
Just clean where they can see.
yeah. We sweep the floor,
Yeah.
wash the carpet.
If there's cobweb, they might take it down, but
Maybe if they could see the carpet.
yeah. But you know, when you're cleaning your body, I mean, your body you need to be detoxed every system.
Every system,
Yeah.
every system, body system need to be detoxified because you're eating food chemicals every day. You're exposed to chemicals in the environment. You're exposed to toxins, you know, at your workplace, depending on where you work. Even anyway, depending on where you work or not, you're exposed to toxins. You go in a minibus, exposed to toxins and viruses and bacteria. You know, wherever you go, the supermarket, the church, you're exposed to all sorts of things that you're inhaling.
Yeah.
Every time you go.
It's true. And I told myself, you going in? No, I don't go home. I stay home.
Yeah.
I don't go nowhere. But you're drinking the yeah, I drink the water. Well, the water got a whole lot of things in it, lead and mercury.
Yeah.
You know.
In the water.
Yeah.
And we no, I'm clean, man. I'm clean. Nothing's wrong with me. Already why are you?
Yeah.
If you're so clean, why are you sick? You know, why you don't feel well? Why when you get up you're dizzy?
Yeah.
Why to climb the steps you're breathing short? You know, why is it that when you go to bed at night you're urinating 10, 15 times?
Yeah. Yeah.
You know, these are signs that are telling you something is wrong. You need to pay attention, take a look, stop, detoxify, you know, cleanse the system, drink more fluids, more water, drink more water, flush your system. You know, so it sounds like it's a lot to do, but when you start doing those things, part of you. Exercise, go walking, do something that will increase your metabolism. You know, something else that is very important that I find in persons who are diabetic is that they have thyroid metabolizing.
Right.
Not burning.
Right.
Not naturally burning because the thyroid is underactive.
You know, it keeps this increase the metabolism and help the metabolism go. So if you have hypothyroidism, you feel, you know, very lazy and you have no energy to do anything.
I want to mention
burning anything.
Dr. Richard, out of time pretty much.
Oh,
I want to mention something quickly. The clinic closes off for the Christmas holiday on December 13th. So if you need to come in, whatever you need to get done, you need to do it before the 13th of December, because after that, it's still 25. The first week in 25 is when the clinic reopens. So I'm just reminding you folks, those of you who are watching, who are listening, to pass on this information. Get for the 13th. Okay. Now, I think the phone is on the screen there. We have a website. If you put in my name on YouTube, it'll come up. Wellness Center GY.com is the website. You go there, you get all. The number to call is 231-6477. Those of you who brought 592-231-6477. You call that number and you speak to someone there between the hours of 8 and when we close. We stop working pretty much when we finish the appointments. We have a very interesting video that we're going to show now. And it's probably, I think you should sit and look at it. There's a lot that you're going to learn about it. And maybe we can discuss some of it. You know, we're probably going to take some calls at some point the next time. We haven't taken many calls for the year. I know folks have things that they inquire about and so on, but take your notes. So don't forget that next week, Thursday, God's willing, we're going to give the formulas out. Not next week, maybe we're going to give the formulas out. Maybe next week because we're closing off early. Give out the formulas black cake for Christmas person, vegetarians without eggs.
I thought I had it. You never said.
I think, but you'll get it next week. Just look at the program. The black pot and the garlic.
No
chips.
egg.
No eggs. Absolutely no eggs. No, we don't deal with that. No. Anyhow, I want to thank you for listening. I'm going to have the program recorded. I'm going to have a recording to look at in just about a minute here. Dr. Dale, I want to thank you for your work. Also, Miss Adams and Miss Auntie Lizzie. We want to thank you guys for really assisting. And I wish you a happy rest of the Thanksgiving day. Those of you who are watching across the world, may you enjoy your festive dinner with your family and friends, right? And I turn you over to Dr. His work.
Heart, the biggest killer. Students, you've all had it written down, but let me remind you, one of the most important things you can do to is plant-based. I mentioned earlier that when I was doing cardiothoracic up in Cambridge, really heavy work, we had to do 3 of these bypasses. But what we had to do is open up somebody's chest, stop their heart, link it up to a big contraption and close them all up again. It was a big, big deal. The pain for months, rehabilitation, and at least a successful operation they'd be alive. But evidence has shown us from years ago that just by changing your healthy plant diet, no meat, no milk, no refined sugar, those arteries that were closing down open up. Now, for me, I've been doing this for many years. Miraculous to me that you can reverse one of the biggest problems in the world in terms of health just by changing diet. You can get rid of doctors like me and you can just replace it with a healthy diet. That is amazing, and I commend some may have heart disease. You may have an appointment to see a doctor in a few months. I can guarantee you, if you go onto a healthy plant-based diet today, by the time you see, you may not even need an operation. I've seen it. So that's heart disease. What about high blood pressure? If I was to ask you, do you know somebody with high blood pressure? Everybody would say yes. It's such a... Now what? You? Well, plant-based diet is absolutely... You have to exercise. I've seen Teeny sitting along this very stage. Your blood pressure. Remember the example I gave you. If you were swimming in a lake, that's fine. If you were swimming in a lake of honey, that will be incredibly difficult because it's thick. And that's what you don't have enough. It becomes incredibly thick. You then use a lot of that blood system. Therefore, your blood pressure has to rise. Here's something that's going on from the plant-based diet. We said that greens do something quite remarkable in our arteries. They get the interior of our arteries to release a chemical called nitric oxide. That nitric oxide opens up the arteries all over. I told you nitric oxide is the ingredient of Viagra. You have heard of it, none of you need to use it, but I can tell you when it comes to dysfunction, rather than reaching for the pill, the best thing to do is reach for those greens. And let me remind you, gentlemen, because this is important, if you have an episode of erectile dysfunction, you're at a high attack. Going to the pill start thinking about changing your lifestyles. Number 3, cancer. What things have we said? Well, I always tell people, and I've been to people in the clinics forever, if you have things that you must, cancer loves sugar, you must eliminate refined sugar. Vitamin D is key. You must have high levels of vitamin D. I recommend 20,000 units per day. That vitamin C, high. I with my very own people on high doses of vitamin C having their cancer reversed. We cannot guarantee it. Don't quote me. You can't guarantee it. But I have seen people on high vitamin C have reversed. And remember, cancer, medical. I told you during the week that those who just say, I just want to go the natural route, often they don't survive. What you must do is and do the lifestyle, and you have the best possible chance of surviving cancer. Medical attention alone does something, but it doesn't do anything. I remember when I used to be in the hospitals, treat you for cancer, and then allow you to eat the foods that would cause cancer. Doesn't make any sense. Hospital treatment is good, but match that with lifestyle change, you've got a great chance of getting through, honestly. Now, what can you do for cancer? I always say you should spice your life. Spices are really the keys to a healthy lifestyle too. They're like nature's natural drugs. The more spices you have in life, the better your cells are to be. Turmeric, most of the oxidant. Take away the oxidation of your cells, it reduces the risk of cancer. Ginger is like it, also anti-inflammatory. Cinnamon is brilliant. Cinnamon, not only does it lower your blood sugar, which, if you have low blood sugar, the cancer doesn't grow too well, but cinnamon is brilliant in terms of fighting off viruses. In fact, 100 years ago, the women who harvested the cinnamon bark never got measles, never got tuberculosis. And cinnamon, if you have anybody in your family who has any kind of viral illness, everyone in the household cinnamon, it's less likely that you'll get the infection. Cardamom is very interesting because it really makes you make more natural. They have an awful lot of white blood cells that defeat cancer. Diabetes. How do you beat diabetes? Definitely you need a healthy plant-based diet. But what else do we need to do? We should, every time you go for a meal and you're a diabetic, as you put your fork down, you should get up and go for a walk. Get up and go for a walk. What does that do? Well, you're using the big body. Those muscles will absorb sugar quickly. And so it will keep your blood sugar levels quite low. You then to release a lot of insulin to the body, and that means cells can become insulin sensitive again. Insulin sensitivity is the opposite of diabetes. It can actually cure diabetes. I've told you quite boldly that anybody with type 2 diabetes does not have to live with it. Type 2 diabetes is completely reversible. Type 1 is more difficult, but type 2 is completely reversible. So you do not have to live with it. Change your lifestyle and get rid of it. Okay, autoimmune disease, that was the last talk I did. It refers to all these antibody diseases that are attacking different parts of the body. There are roughly 400 or 500 of them. Wherever you've got tissues in your body, you have an auto-antibody if things go badly. And I must say, although I didn't talk about it, one of the biggest causes of infertility, autoimmune disease. Now, I know people go to the hospital for eye treatment, absolutely, but rarely do they get to the bottom. And it's that you've got these organs in makes it almost impossible to conceive. So everything we talk about with autoimmune disease, you need to apply if you want to get pregnant. Okay. Now, you see my details. I'm hoping that in 9 months I'm going to get lots of communications of people saying, we have a child. So it's possible, believe me. Some of the things if you didn't cover, if you weren't here the other day, some of the big things that you need to do to get rid of autoimmune disease, get rid of milk, because milk is one of the key, generates these, deal with stress, make sure you're avoiding sugar, have high dose of vitamin D. If you do that, you have a great, great chance. A bit like a little boy, Bart Simpson. Stay away from the milk. Okay. Now, it is increasing on this continent of Africa. Didn't used to be. You go back 50 years, there was very little continent in Africa. Now, with all of the imports of Western culture, including Western food and Western lifestyle, we're getting exactly the same problems that they get in the West. How do we defeat it? I always say, get rid of white stuff. This is not a racist statement, folks. This is not a racist statement. White flour, white, and of course that white substance, sugar. You know, sugar, if you look at it from afar, it looks a bit like heroin. And by the way, it activates exactly the same parts of your brain for heroin addiction. Giving up sugar can become so difficult. But remember, I did help in overcoming sugar addiction. Remember the Dr. Chitty method? After some obscure doctor, you remember that? For those, when that donut is calling out your name, the do eat the, because if you do that, your brain will just desire it even more. What you must do is say, I will eat the donut, but I'll eat it in half an hour. At the same time, eat half an apple. Now that apple will release sugar slowly into your bloodstream, slowly so that you don't get this insulin spike. And after half an hour, sugar in your system, the desire donut. If at the end of the half an hour you still want that donut, do the same thing again. At the end of the day, you may have eaten 5 apples. That's okay. That's your 5 a day, right? But even if you succumb to the donut, I guarantee frequently didn't try the Dr. Chitty method. What does Dr. Chitty stand for? Don't resist it, choose to have it, but delay it. Dr. Chitty, there you go. Remember my name. Okay? That's the only reason why I did it for you. But seriously, sugar has been a serious business. We used to be slaves for sugar, now we're slaves to sugar. We need to get rid of the sugar, absolutely. Let's not forget dementia. Okay, some of you understood what I was saying. Must not forget dementia. Okay, I can hear one person, they've understood. Right, dementia, for me, is now one of the most feared diseases around. When I was younger, a younger doctor, it used to be cancer. But now dementia, losing your memory, losing your personality, nobody wants that. It's a fearful thing. Good news is, and there is good news about dementia, it is a lifestyle disease. It is not random. You may have seen studies to say, well, there's a genetic makeup. There is. There are genes for dementia. But there are people who have the gene for dementia who don't get dementia. There are people who don't have the gene for dementia who get dementia. The biggest factors are lifestyle. So, for example, you will know that if you have high blood pressure, that's a risk for dementia. If you're diabetic, and the biggest risk is long periods of stress in your adult life. If you do not manage stress in adult life, that is the biggest risk factor for dementia. So we're going to need to know how to manage the stress. We're also going to have to change our lives. So make sure we have. There's been lots of studies on this continent There's been a Nigerian study which showed that the more berries you have in your diet, the less likely you are to have Alzheimer's. It's even more significant. They have shown that if you have early signs of dementia, you go onto a healthy diet, have lots of berries, you can reverse up to 90% of the symptoms. And maybe you've never heard that before. Because most people think, once I've got dementia, it's just a long road down to ruin. That's not true. And you can reverse % of the symptoms of dementia. Talking about stress, we spoke a little bit about depression and anxiety and stress. What little signs can I give you to help? Well, remember what we said. There are triggers for depression. There are triggers for stress. And the big ones are debt, divorce, disease, death. We can't avoid some of them. But when they come to us, the best thing to do is to not hide away, keep it to yourself. The best thing to do is to get help quickly. The quicker we get help, the quicker we understand that we're not alone through exactly the same thing, the quicker we can cure ourselves or head off depression. What else do we need to do? If you're depressed, you might find it, but one of the ways to break the cycle of depression is to get into some physical activity, whether it's going for a walk, a run, a swim, whatever. Maybe you need somebody to encourage you to do it, but it will break that cycle of depression quicker than just about anything. The next thing you can do is do something, even if it's small, for somebody else. That sounds strange. You're depressed. Why am I going to do something for somebody else? Well, we have shown through scientific endeavor that by doing even a small thing, it takes your mind off of yourself. And that can break that cycle of that spiral of self-thought. So the more you can do for somebody else, even if you don't feel like it, think of it as if you're doing something for yourself when you're doing something for somebody else. Being kind to somebody else, actually being kind to yourself. What else? I mean, we have to know how to heal from depression, and we've talked about it a lot. The quicker we can start to forgive ourselves, if you're able to do that, it is a release from the grips of depression and stress. Every study I've seen in the last 10 years has an element of letting go of past trauma, of past hurt. The quicker we're able to do that, the greater the chance we're going to be free from depression. And we want to be free from depression. Because in fact, even at the heart of most of these diseases is a level of stress. Stress makes every disease worse. It doesn't one disease. Right, so we know that disease is what? Dis-ease. So if you want to get rid of disease, we're going to have to start to be at ease with ourselves. We can only do that if we learn to forgive. And if we look forward and stop looking back.
You or someone you know is sick, to get help and is not any better, then call or visit the Health and Wellness Center, where we will screen your entire problem and treat you so that your body will overcome you. So visit us today, 72 Queen Street, or call us at 231-647 for further information.